So public health overall in the vaccine business is shifting. What that means is as public health is weakened, additionally, these changes also make the unit economics worse for providers. So less providers want to be in the vaccine business. That means providers are willing to refer the patients somewhere else to get their shots. So we're going to see this continued trend towards retail health for vaccine work, where a pharmacy, for example, has better unit economics to run a vaccine program. In addition, you're going to see a lot of simplification of vaccine work. So a competitor of ours, VaxCare, has emerged kind of in the vaccine RCM revenue cycle and management kind of business. And so creating new billing solutions that take away some of the administrative work of vaccines and inventory management is a huge benefit to providers and pharmacies, et cetera, because it means that on a business that has very little margin, you can kind of recoup a little bit more margin. So I think the shift in the vaccine business is kind of threefold. I'll start with the public health side, which is the education side. CDC is not doing a lot of education these days. So it's now up to local health departments and health plans to lead and providers to lead education campaigns around you need this vaccine, you need the HPV vaccine, et cetera. These are amazing tools to reduce disease rates, reduce cancers. That saves healthcare system costs. So those who have the incentive need to take up the education mantle and roll that out. Second, providers. There's a lot of confusion. So I look at the vaccine hesitancy problem from multiple lenses. One, there's, yes, just the deliberate misinformation by certain individuals. That's a contributing factor. But also, some of the successes during the pandemic have actually caused a lot of confusion. A whole new vaccine platform, mRNA, new technologies, new vaccines, differentiation between vaccine brands. It used to be that a provider said, you just need this vaccine, and you get that shot. Now, consumer actually has a choice. Which of these RSV vaccines is better for me? I want this brand or this brand. Like there's variation in the market. So some of the success is also creating complexity, which creates confusion, which also confusion leads to delay. And that is also very much part of that hesitancy bucket. So providers at the end of the day and consumers need a new set of tools to help you understand what vaccines you actually need, when you need them, why you need them, and which product to get and where to get that product. It becomes a very complex matrix of variables that the current system is not built to support.